An ostomy is a surgically created opening from an internal organ to the body's surface. An ostomy is needed when the body's normal elimination is no longer possible. Ostomies may be temporary or permanent. A temporary colostomy is often a transverse colostomy. It may be created for a period of time to prevent stool from passing through the area of the colon that is inflamed, infected, diseased, or newly operated on, thus allowing healing to occur. Such a colostomy is usually temporary. Depending on the healing process, the colostomy may be necessary for a few weeks, months, or even years. Eventually, given good health, the colostomy can be closed and normal bowel continuity restored. In a colostomy reversal, the two ends of the colon are reconnected and the area where the stoma was created in the abdomen is closed. The large intestine is made once again into a continuous tube between the small intestine and the rectum. Bowel movements are eliminated through the rectum. A permanent ostomy may be required when disease or its treatment impairs normal intestinal function, or when muscles that control elimination do not work properly or require removal. The most common causes of these conditions are low rectal cancer and inflammatory bowel disease. Ostomies from the small intestine are called ileostomies. Ostomies from the colon are named by the section of colon they are created in, such as transverse, ascending, descending, and sigmoid. Colon ostomies are also just called colostomies. The thickness of stool from an ostomy depends upon where the section of intestine was taken. In an ileostomy, which is taken from the small intestine, the stool is liquid and full of acids and enzymes. An ostomy from the ascending colon would have stool that would be liquid to semi-liquid. In the transverse colostomy, you would expect liquid to semi-formed feces. In a descending or sigmoid colostomy, you would find semi-formed or normal type stool. An ileostomy is a surgically made opening in the small intestine. The distal end of the ileum is brought up to the abdomen to form a stoma. This makes stool bypass the colon. Sometimes the colon, rectum, and anus are removed. This type of stoma is created for patients with ulcerative colitis, Crohn's disease, and congenital defects. The patient with an ileostomy has to learn some important management tips. Foods high in fiber may give this patient a problem. This patient must learn to chew food slowly and thoroughly. Food should slowly be added back to the diet and watch for reaction. The patient also needs to stay well hydrated with 8 to 12 cups of water daily. The most common type of colostomy is the sigmoid. It can be double barrel, but the single barrel ostomy is the most common. Firm formed feces is expected from a sigmoid or descending colostomy. This is the only type of colostomy that may benefit from irrigation. Elimination may occur at the regular predicted intervals. This would allow for the use of a cap in between intervals. Those patients who were regular before surgery are most likely to become regular after a colostomy. When you look at a stoma, you are actually looking at the lining of the intestine. It is warm and moist and secretes small quantities of mucus. A stoma has no nerve endings, so it isn't painful. It is full of blood vessels and may bleed easily if rubbed. Skin irritation can usually be prevented by having a correctly fitted pouch. An ostomy appliance or pouch is designed to catch stool. The pouch is made of plastic and is held to the body with an adhesive. The adhesive, in turn, protects the skin from moisture. The pouch is disposable and is emptied or changed as needed. The system is quite secure. Accidents are not common, and the pouches are odor-free. Although it will take some adjustment, patients with a colostomy can resume most, if not all, of their regular life activities. There is a misconception that it is difficult to hide the pouch and the smell of feces or to keep the pouch securely attached. However, modern colostomy pouches are well designed, odor-proof, and allow stoma patients to continue normal activities. This is an example of a mother who made this little bear for her daughter who was about to have a colostomy installed, and she wanted to show her daughter what the process was going to be and what the end result was going to look like. The most common skin problems is due to stool irritation. It's due to an appliance with an opening that is too large. Too much skin becomes exposed and stool comes in contact with it, which causes irritation and erosion. The opening of the appliance should be no more than 1/8 of an inch larger than the base of the stoma. This allows for adequate skin protection, but also ensures some wiggle room for peristalsis or normal movement of the stoma. Another common problem after colostomy surgery is the development of a hernia around the stoma site. This is manifested as a bulge in the skin around the stoma, difficulty irrigating, and partial obstruction. Heavy lifting should be avoided immediately after surgery and should only be resumed under a physician's guidance. Many of these problems can be avoided if the stoma site is marked by the ostomy nurse before surgery. The preferred site lies within the rectus abdominis muscles near the midline. The development of a stoma hernia is often a gradual phenomenon, with the area next to the stoma stretching and becoming weaker with the passage of time. This weakness, or the gap, means that every time one strains, coughs, sneezes, or stands up, the area of the abdomen next to the stoma bulges, or the whole stoma itself protrudes as it pushes forward by the rest of the abdominal contents behind it. As with all hernias, the size will increase as time goes by. Stoma hernias are rarely painful, but are usually uncomfortable and can become extremely inconvenient. There are two options. One can move the stoma to a new site on the abdomen, which would create a new opening elsewhere and repair the hernia of the old site, or one can try to repair the hernia around the stoma, leaving the stoma where it is. Wound ostomy incontinence nurse, also known as an enterostomal therapy nurse, is a person who takes care of and teaches ostomy patients. A special training course for registered nurses is required for certification.